Miss Bell is a 45-year-old female who presents with rapid onset left-sided facial droop that has resolved with no history of hypertension or diabetes. Family history is positive for a stroke and MI. She advised acute onset this morning that resolved by midday. No additional neurological symptoms were reported by Miss Bell, and no apparent alleviating or aggravating factors were reported as well. Past medical history, no history of hypertension or diabetes. She is not currently taking any medications, and no allergies reported. Past family history, she reported her father having suffered an MI at 50 and her mother having passed away with complications from diabetes. Social history, no current significant stressors, no tobacco use, and 1 to 2 alcoholic drinks per week. Sexual history, currently sexually active, no history of STIs. Review of systems, neurologic first, negative for visual field impairment, negative for jaw weakness, negative for urinary retention, negative for tingling sensation of the face. Cardiovascular findings, negative for chest palpitations. Physical exam findings, general, responsive and well kept. Temperature was at 98.8, blood pressure at 100/70, heart rate at 75, and respiratory rate at 16. Neurological physical exam findings, pupils equally round and reactive to light and accommodation. Weber test results were equal bilateral. The Rhine test indicated bilateral air greater than bone conduction. Uvula midline with no deviation. Extraocular movements normal bilaterally. Facial sensation normal bilaterally with positive jaw jerk. Facial movements also normal bilateral. And tongue protrusion indicated no deviation. Shoulder shrug normal bilaterally. Assessment. Miss Bell is a 45-year-old who presents with rapid onset left-sided facial droop that has resolved with currently normal neurological exam findings. Given the acute onset and rapid resolution of the symptoms, a TI seems most likely affecting the left cranial nerve 7. Additional imaging is needed to rule out a damage consistent with any stroke. And our plan is as follows. Head imaging to assess focal hemorrhagic or ischemic damage. Neurological consult should be requested. And upon consultation with neurology, a possible recommendation for prophylactic low-dose aspirin or other anticoagulating medication.